Thank you for taking the time out of your busy day to hear me talk about COVID-19 and why you should take it seriously. By the end of my speech, you should believe that younger people should take it seriously. A huge percentage of COVID-19 patients are below the age of 50, and that is as high as 40% in some areas. Everyone can be affected by this, because if one person catches COVID-19, they are very likely to pass it on to many others. This is especially important for people who are at risk with underlying medical problems and or is older in age. However, it can still be very harmful to people younger in age. I used to be one of the people that didn't take the coronavirus scare seriously, as I was a person who was very much working with the public as a writing tutor, server, and an assistant supervisor at SeaWorld. So it took me a lot of shock and sometimes fear to get to the place that I am today, informed and cautious. My hope is for you, my audience, to skip over the shock and the fear. So I did my research and listened to acclaimed doctors and scientists working with the virus. I'm not an expert in the slightest, but I sincerely care about my family and people in general. So I strive to stay informed about the virus as well as we all should. Ideally, my audience should feel more informed and it needs to be more active in social distancing and acting more safely in general. One can start by limiting how much they go out by mainly ordering groceries, food, and other goods for delivery. It is important that people are still exercising, so leaving the house to do so is actually encouraged. Just maintain social distance and refrain from gathering in groups of 6 or more, or any group if it's not necessary. If doing so is impossible, it is important to wear protective gear like a mask, whether store-bought or homemade. And if possible, you should sanitize all your products entering the household. Let's begin by looking deeper into misinformation about COVID-19. It's misinformation that young people are not affected by COVID-19, but they are. According to a report by Amy Gunya from Time Magazine and the CDC, 38% of coronavirus patients in the U.S. who were sick enough to be hospitalized were under the age of 55. This is a huge amount of people and completely goes against what we may have initially thought about COVID-19. Also, according to Lisa Lockard from Johns Hopkins Medicine, coronavirus infections requiring hospitalization are not only possible in younger adults, but the rate of these cases is higher now that the virus is spreading across other countries. You may be thinking, wow, this is a serious problem, but what does it have to do with me? So now I will show you how you are impacted or someone you love will be impacted. This problem affects us by being directed at our age group and everyone's age group actually. According to WTOP News, this coronavirus disease isn't just a disease of the elderly, which was stated by Dr. Ryan, who's the executive director of the World Health Organization's Health Emergency Program. There is no question that younger, healthier people experience an overall less serious disease, but a significant number of otherwise healthy adults can develop a more severe form of the disease. Also, according to the U.S. News' Health Day reporter, Serena Gordon, news reports have shown young adults and teens packing beaches and bars for spring break, ignoring public health officials' pleas to practice social distancing and acting as if the world isn't in the throes of a pandemic. Many of us have also seen those videos online of spring breakers proclaiming their lack of worry for COVID-19. At this point, it should be very clear that younger people not taking the COVID-19 disease seriously is a serious problem, and it is also a problem for all of us. Now I want to tell you about the solution to this problem. The solution I propose is to continue to try to spread the correct information. Spreading the correct information about COVID-19 attempts to take away the misinformation that started the issue in the first place. According to the CDC, COVID-19 spreads mainly among people who are in close contact within 6 feet from each other for a prolonged period of time. Spread happens when an infected person coughs, sneezes, or talks, and droplets from their mouth or nose are launched into the air and land into the mouths or noses of people nearby. Although the risk of severe illness may be different for everyone, anyone can get and spread COVID-19. Everyone has a role to play in slowing the spread and protecting themselves, their family, and their community. Unfortunately, after finding about the high infectiousness of the disease, according to the University of Michigan's David Hutton, the good news is that after about 2 weeks or so of practicing social distancing, it looks like the number of new cases per day does seem to be peaking, plateauing, and then declining. In conclusion, there is misinformation that younger people are not or cannot be heavily affected by the virus and that only older people are seriously affected. But the solution to combat that misinformation is to keep trying to inform young people with the correct information. I'm so passionate about this subject because I have personally seen young, healthy individuals completely disregard COVID-19 precautions and unfortunately become very ill. And that is the last thing I want to happen to any of you. Ideally, you all should feel more informed and a need to be more active in social distancing and acting more safely. It is also important to not be afraid but cautious in order to come out of this pandemic stronger and more united. Thank you.